Great act of altruistic solidarity from Cuba. I want to get the very latest. We spoke to Denosa. I want to get Cosatu's take on this matter. Now, Cosatu spokesperson Sizwe Pamla joins us via Skype. Sizwe, a very good morning to you.
Morning to you and the viewers.
So, Cosatu, you welcomed the arrival of the Cuban medical team. The question is, though, is South Africa ignoring its own healthcare professionals, some of whom remain unemployed, according to reports?
No, our view is that, firstly, this is a temporary arrangement where you need all of the help that you can get. And of course, we are concerned that there are health professionals who are at home, especially because we know that we don't have enough health officials in our health facilities. But what the Cubans are doing, it doesn't take away from us. Those are the issues that we need to talk about and focus on fixing as a country going forward. Those are long-term issues. But right now, with all of the world struggling really to fight this virus, any help that you can get is welcome. So our position is that the Cubans have been working with us for a long time. I mean, we know of the students who've been sent to Cuba to study medicine, and the Cubans have been there side by side. So it's not a question of them coming to fix our problems. Those are the problems that we have, we know about. Our responsibility is to get on with the business of fixing them. Yeah. But we welcome the fact that the Cubans, at this time when they themselves are struggling with the economic issues, they are still able to extend a hand of solidarity. That is what we appreciate.
Look, a pandemic can do that, isn't it? It can expose certain faults, certain issues that a country might have, especially with regards to inequality, especially with regards to unemployment, poverty, hunger, etc. The information that you have, Sizwe, with regards to unemployed medical professionals, health professionals in South Africa, what sort of numbers are we talking about here?
Well, we don't have specific figures per se, but look, the problem here is that we have a lot of people who have qualified who are not able to get jobs. But we also have a lot of people who have qualified only to find out that they were victims of bogus colleges where they carry qualifications, but those qualifications are not acknowledged by the qualifications authority. But we do have a lot of vacancies in the health sector, and we do have a lot of health professionals who are seated at home. That has always been a problem, and it's something that we've consistently raised with the Department of Health. And we have affiliated unions under Cosatu in the health sector who have been very vocal on these issues, and they continue to talk to the department and relevant authorities to make sure that this issue is sorted out, especially when you look at the number of health professionals in terms of nurse-patient ratio and doctor-patient ratio. Then it is not acceptable that there are qualified people who are at home. Yeah. So we need to talk about those issues. The issue of the austerity budget, the cuts, public service cuts. We need to have a conversation about those issues after this all is over, because now we know that we need the public service. This is the public service that is carrying us on its back. If we don't give it necessary resources, then we'll struggle going forward. These are legitimate conversations that we need to have going forward.
No, legitimate indeed. You say these are long-term issues, but what has your organization, what has your union done in order to help in this regard?
We have Nehau, we have Denosa, we have Saib in the health sector. We have been very vocal and consistent in raising these issues with the department. I mean, if you've been paying attention, this is one issue that as far back as 2007, these unions have been campaigning with the support of the Federation to make sure that we actually fill these vacancies. In fact, if you look at when we go for negotiations, these are some of the issues that we consistently raise to say you have an overburdened workforce in the health sector. And when you have an overburdened workforce, then you are going to struggle to see any turnaround. And as far back as 2011, we were part of the Human Resource Strategy of Health that made a lot of commitments to say these issues will be addressed. But a decade later, when you go and ask to say, can we get a report back in terms of how far have we gone in terms of implementing that resource strategy, then at a national level, they start to tell you that health is a provincial competence. They don't have the data. So these are the problems that we've been dealing with for a long time. The problem is that now that we are in a crisis situation, we're starting to look at them differently, and we're happy with that it means that we cannot postpone this anymore.
Well, it's crises like this that expose these fault lines that we keep on talking about, and that's why we're talking about, or experts and government is talking about flattening the curve, where you don't overburden the health system. I want to talk to you about Cuba and a relationship with Cuba as South Africa. The support goes back many years. Talk to us about the Cuban Medical Internationalism Program. I understand it was from 1996 to 2002, if I'm not mistaken. And this began with the deployment of about 450 Cuban doctors in medical lectures. Talk to us about that program.
Well, the Cuban medical program is a very good program. In fact, it is one thing that we can all copy and learn from. Because South Africa, of course, our relationship with Cuba goes further than that. I mean, Cuba was able to send its people to help us to defeat apartheid. But as soon as we came out of the apartheid system, the Cubans were there with us to make sure that, firstly, we can send our own students to Cuba to enroll for medical training, and they were also ready to deploy more than 450 Cuban doctors and medical lecturers to actually work with us so that we can fix our health system. Because when we are talking about NHI, for an example, as Cosatu, we have been saying that it's not just a question of having a fund, an NHI fund, but we need to turn around the health system itself into a primary healthcare system that talks to people doing everything to avoid getting sick, rather than to say adopt a curative system where we say let people get sick and then we'll give them medication. So the Cubans have been very instrumental in really sharing us their knowledge with us to make sure that as and when we embark on this process of turning around our health system, they are able to share their expertise and their know-how to make sure that as South Africans were able to do this successfully. So we have a very high appreciation of the solidarity and support that the Cubans have been giving to South Africa. And we hope that this relationship can continue, because we have a very high disease burden as a country. We need to fix our health system. I think that the Cuban model
unfortunately, we lost Sizwe there, but I think we got the gist of the perspective he's put forward. Sizwe Pamla is Cosatu spokesperson. We're going to take a quick break. We'll be back at the top of the hour. I want to engage health activist Dr. Jose